Have you been floxed? Let's find out. Hello and welcome to another edition of the Ask Dr. Pickel show, where we help people find answers who have chronic health conditions, chronic health problems. And today we want to talk about people who have been floxed. What does that mean? And has it happened to you? And if it has, what the heck happened? And what do you do about it? All right, so just a brief history there. As far as let's say about 8 or 9 years ago, I cared for a patient that she basically had come in. She had told me, she about 6 months prior had been suddenly diagnosed with diabetes, inflammation in her liver. She sprained her Achilles tendon. A sprain is like a tear. So all of a sudden, and she could hardly walk because of that. She was having to walk with crutches all the time. And so, but this was all sudden. It's like, wait a second. And then she was like, my prior blood work, I did fine. I've never had a problem with my Achilles tendon. I've never sprained an ankle. I'm a healthy person. I work out. She was in her early 30s, and she goes, and I said, well, what happened here? And she goes, well, I went to the doctor. I had a gut infection. They gave me an antibiotic, and then the gut infection, the gut symptoms all went away. She said, but after that, she never felt the same. She felt like her energy levels bottomed out. She just felt yucky all the time. She just really said it's like her life changed, her health just changed. And then, she went back into the doctor and they said, hey, it's just, you're probably still fighting this infection. Gave her another round of these antibiotics. And then after she came back after that and was still feeling lousy, they finally ran some blood and they said, hey, you've got diabetes, your liver's inflamed, this and that and that. And she goes, well, what happened to me? I mean, this was, I was fine before all of this. And they're like, well, it just happened, you had this infection, but you probably already had these other issues. And she was like, well, no, my blood work was fine before. So there was really no explanation. So she's like, I got to find some answers. And so when she came to see us, we were like, hey, let's find a little more information about what's going on. Because when things just pop up out of nowhere and all of a sudden I've got all these diagnoses, there's usually a cause, there's usually a reason. Things don't just happen willy-nilly for no reason. So, we started to look into, hey, well, what did you take? What did they give you antibiotic wise? Well, they gave her a drug called ciprofloxacin, and which is a fluoroquinolone drug. So, at that time, I've heard of them, but I really didn't know as much of the details about fluoroquinolone drugs. So I started digging and say, wait a second, what is it about this class of antibiotics? And some of them you may, that I've highlighted in bold in here, you may recognize. But also what you find out is that these drugs have a black box warning, meaning the FDA has said, these drugs are dangerous. They should not be used unless it's a last resort. They should never be used as a first line therapy. So already we know this is bad. These drugs can do some pretty bad damage to people. So what can they do? Well, look at that. Tendon rupture, nervous system disturbances, heart, kidney, and liver damage, diabetes, and then they call it FQ associated disability. So finally, enough people got injured or damaged by these medications, that these antibiotics, that they finally said, hey, this is real, because doctors were saying to patients, hey, this is unrelated. It's not, how can an antibiotic do this or that? Well, finally they did enough research to say, hey, yeah, these people are getting damaged by this drug, these fluoroquinolone drugs, and here's a class of disability for them. Now, also, what happens here? What is going on that's causing this? Well, the first thing is oxidative stress, and we're going to talk more about that in a minute, because that's like, just setting off a bomb in your body. It's doing all kinds of damage. It's accelerating the aging and degeneration process inside the body. These drugs bind to metals and your important metals in your body. We need these minerals, these magnesium, calcium, zinc, copper, manganese, iron, and likely selenium. These are extremely important so that enzyme reactions, every function of our body can occur. We got to have those nutrients or things start to break down. And then next one here we see is damage to mitochondria. These are these areas in our cells where we manufacture energy or ATP. So yeah, you start to break that down, you start to cause problems there. Dangerous for everything. Everything in your body relies on fuel. These are like the big batteries in your, if your battery isn't working, nothing works. All right. And then also part of that disruption of cellular energy pathways, which kind of goes along with that. And then damage to DNA. What happens if you start damaging DNA? Well, things start to break down in the body. You increase your risk of cancer. So many problems with issues like that. So very important. So what really occurs here? Let's kind of go into this here. All right. So when you take a fluoroquinolone drug, this has an effect. And this is, let's put you inside of your mitochondria. We're inside the cell. There's these little guys inside the cell, guys, gals, inside the cell that make energy. They're called mitochondria. And to make that energy, inside of them, there's what's called the electron transport chain. You don't have to know that, but that's what this little diagram is. And then basically electrons go through this, they go through a process along with oxygen, and then it turns eventually into ATP, which is energy. Now, when you manufacture things, yeah, you get the great benefit of making ATP, but also there are things that go into the manufacturing process that we got to get rid of, kind of byproducts, I guess you could say. And these byproducts can actually be toxic or problematic. And so our body has to get rid of these byproducts. So there's kind of a pathway to do this. And if you follow the arrows here, this is kind of the pathway of getting rid of these bad products. So basically we start off with oxygen. That's at the beginning here. And then that oxygen, once it goes through, it turns into what's called superoxide dismutase. That's one of the byproducts. So this superoxide anion, and it's destructive, it's inflammatory, it's an oxidant. Think of oxidation like rust. Look at like a rusty car. Yeah, that's oxidation. Now think of that happening inside your body. Not a good thing. All right. So in order to break down this superoxide dismutase or superoxide, we've got to use this gene called superoxide dismutase. And this gene needs to be working good. Many people have autoimmune conditions, chronic health conditions. They'll have a genetic SNP with this gene, polymorphism. So this gene doesn't work as good. So sometimes this can back up. Now, another thing that happens is more important down here. These fluoroquinolone drugs, they basically deplete what's called GPX, glutathione peroxidase. So now if you deplete this, not good, because then when your body tries to get rid of hydrogen peroxide, yikes. So when we think of hydrogen peroxide, we think of, hey, yeah, you pour it on some bacteria, bubbles and fizzles, great stuff, kills the germs. Don't we want that in our body? No, it is toxic inside of our body. That gets in our bloodstream, that gets to our cells, very damaging. It's an oxidant. It causes that rust reaction like I was talking about. So again, we've got to get rid of this hydrogen peroxide. And these two guys, CAT, which is catalase, and GPX, glutathione peroxidase, they break this hydrogen peroxide down into water, actually water and oxygen. So those are safe. Our body likes those things, no problem at all. But if these are not working, if this GPX is not working, because of this, then we get a buildup of hydrogen peroxide. So what happens when that occurs? Yeah, oxidation problem, all these health problems, these symptoms and problems that we talked about. And if that backs up, that puts more pressure on this gene. And then all of a sudden, this is going to back up, and then we get more superoxide increase in here. So we've got now 2 free radicals, 2 oxidizers just building up in our system, causing destruction, causing all these symptoms and problems, all because of this fluoroquinolone, that list that I gave you, these possibilities. And again, this is going to occur more in people who have issues already, usually, whether they have genetic SNPs of these genes or they have chronic health issues, autoimmune conditions where inflammation is already there and oxidation is already occurring. The system can't handle this extra hit that just came into it. So what do you do about this? Can we do anything to help here? Oops, there we go. All right. So yeah, the first thing we've got to do is support the genes. We've got to support them so they can deal with the hydrogen peroxide better, so they can deal with the superoxide free radicals better. Probably one of the most important things, resveratrol to get the inflammatory cycle down to help control the oxidants. Copper, zinc, these are depleted by the cipro. And then also the manganese, which is depleted, which is important for your mitochondria, the ubiquinol, important for the mitochondria, and a bunch of other things. And then glutathione, which is like the mother of all antioxidants, pretty important. Now, another thing to add to this list would be selenium, because it many times is depleted too, and that can have broad effects on the body too. I think there's another video that I've done on selenium. Mitochondrial cellular damage, we can also add these things in to help during the repair damage process: NADH, ribose, essential fatty acids. And then for detoxification, how do I get this stuff out of my body? Because, you know, a doctor might say, hey, yeah, antibiotics, they just go out in your urine, go out in your stool, no big deal. That'll just flush out of your system. No, this stuff has crossed the blood-brain barrier. This stuff has gotten into cells. It's gotten into these other areas of the body. You got to get it out. So yeah, you could do that. You could say, oh, I'm going to take a bunch of supplements, or I'm going to do some chelation. Well, that's a little scary, because the thing is if you try to chelate yourself, if you try to detoxify via a lot of supplements, your liver, your kidneys, your lymphatics, they can only handle so much per day. And if they're already overloaded because you have other health conditions, then you just overloaded them more. And now you're redistributing other toxins in your body. That's why 50% of people get worse when they try those methods. The thing is I really love this, what's called causative homeopathy. This is a way to detoxify what I would call safely and at a rate that these detoxification pathways can handle. I won't go into that as much now. That can be in a different video, but there are ways to get rid of this stuff. Not only the antibiotic residues, but also the heavy metals like the fluorine, which is fluoroquinolone. All right. So now there also is one more thing too, more recent that the FDA put out, not even more recent. This is probably back in like 2016 or so. But what these were symptoms that I didn't add to my list. Another thing that can occur because of this fluoroquinolones is the hypoglycemic coma, not good, and psychiatric adverse events. Yeah, you know, just more trouble that can come from this stuff, and we don't even know. And basically, they've petitioned the FDA. The public has petitioned the FDA to say, hey, add this to the list. Add these psychiatric adverse reactions. Add these hypoglycemic comas to the list. And you know, it's just very frustrating, especially if this has happened to you and damaged you. So I hope everybody got some great information from today. Have a wonderful day. God bless, and I will see you next time.